Senate panel boosts NIH budget, rejects Trump's 40% cut proposal. In a bold move that defies the Trump administration's controversial proposal, a bipartisan group of senators has thrown their support behind a $400 million boost to the National Institutes of Health's NIH budget. This decision, made during an Appropriations Committee vote, not only counters President Trump's plan to significantly slash the agency's spending, but also sends a clear message about the Senate's commitment to scientific research and health initiatives. The administration's proposal, which aimed to cut the NIH's budget for the 2026 fiscal year by a staggering $18 billion, or 40%, was met with staunch opposition. The committee's decision to maintain all 27 NIH institutes and centers and to reject the White House's consolidation proposal underscores the Senate's dedication to preserving the breadth and depth of medical research in the United States. Additionally, the committee stood firm against the administration's plan to overhaul the reimbursement system for universities, medical schools, and other research institutions for indirect costs. The appropriations bill for the Departments of Labor, Health and Human Services, Education, and related agencies was reported to the full Senate with a resounding 26-3 vote, with prominent Republican senators such as Mitch McConnell of Kentucky and Lindsey Graham of South Carolina among the supporters. This move not only challenges the administration's fiscal policies, but also highlights the Senate's willingness to prioritize health and science over budgetary austerity. But here's where it gets controversial. The decision to defy the White House's budget proposal could set the stage for a larger debate on the role of government in funding scientific research. And this is the part most people miss. While the Senate's move is a victory for the NIH, it also raises questions about the future of other federal agencies and programs that might face similar budget cuts. So what do you think? Is the Senate's decision a necessary step to protect scientific research? Or is it an overreach of government spending? Share your thoughts in the comments below. Senate panel rejects Trump's $18 billion NIH budget cut. What it means for healthcare. Here's a pivotal moment in healthcare policy. A bipartisan Senate committee just shut down a plan to gut critical medical research funding. This isn't just a political win. It's a lifeline for scientists and patients alike. But here's where it gets controversial. While lawmakers rejected massive cuts to the National Institutes of Health, NIH, they also sidestepped a sweeping reorganization plan that could have reshaped how the U.S. tackles public health crises. Let's unpack what this means for the future of American healthcare. The Senate Appropriations Committee voted 26-3 to boost NIH funding by $400 million, directly contradicting President Trump's budget proposal that aimed to slash the agency's budget by $18 billion, nearly 40%. This decision sent a clear message. Congress isn't backing down from protecting medical research, even in the face of political pressure. Democratic Senator Patty Murray, a committee vice chair, emphasized the stakes. To the scientists wondering if there will even be an NIH by the end of this administration, this committee's resounding message is yes. But here's the twist. The White House had also proposed creating a new agency called the Administration for a Healthy America, AHA, which would have merged multiple existing health programs under one roof. This reorganization would have folded the Substance Abuse and Mental Health Services Administration, the CDC's chronic disease divisions, and other key offices into a $20 billion behemoth. Lawmakers didn't mention this plan at all in their final bill. Why? According to a committee spokesperson, HHS never submitted the required formal reorganization plan to Congress, and 6 months of review time vanished without a trace. This raises a critical question. Should agencies like NIH and CDC be restructured to tackle modern health challenges more efficiently? Or does the White House's approach risk destabilizing proven programs? Critics argue the AHA plan could dilute expertise by merging disparate health initiatives, while supporters claim it would streamline efforts to combat issues like obesity and mental health. Where do you stand? Meanwhile, other health headlines are heating up. Vaccination rates for kindergartners dipped below 93% for key immunizations in the 2024-2025 school year, according to CDC data. A worrying trend as preventable diseases resurge. Democrats are also positioning healthcare as a key issue in the 2026 midterms, with North Carolina as a prime target. And President Trump's plan to revive the Cold War-era presidential fitness test has sparked debates about whether such policies are outdated or necessary in the face of a national fitness crisis. But let's not forget the local stories shaping healthcare. A California bill aims to ease medical debt burdens. Massachusetts grapples with safety failures in assisted living facilities, and Texas advocates are battling vaccine hesitancy, fueled by high-profile figures like Robert F. Kennedy Jr. So what's next? Will Congress continue to resist administration efforts to reshape health policy? Or will political pressures force compromises in the future? We'd love to hear your thoughts. Agree with the NIH funding boost, or do you think the White House's reorganization plan had merit? Drop a comment, and let's keep the conversation going. Funding for health, education, job training projects in Mississippi, FY 2026. Imagine a future where federal funding actively boosts health, education, and job opportunities in Mississippi. This is exactly what the recent legislative developments aim to achieve. But here's where it gets controversial. Not everyone agrees on how these funds should be allocated or whether they will truly make a difference. And this is the part most people miss. How these decisions could shape the lives of thousands in the state. Recently, the Senate Appropriations Committee approved the FY 2026 Labor, Health and Human Services and Education, Labor HHS Appropriations Bill. A crucial step toward channeling federal resources into vital projects across Mississippi. U.S. Senator Cindy Hyde-Smith, a Republican representing Mississippi, cast her vote in favor of this bill, which is designed to support initiatives that improve maternal health, enhance educational opportunities, and expand job training programs within the state. Hyde-Smith plays an active role on the Senate Labor HHS Appropriations Subcommittee, which crafted this funding proposal. The bill was approved by the full Senate Appropriations Committee with a strong bipartisan vote of 26-3 and is now set for further consideration by the entire Senate. Mississippi has made impressive strides in bettering health outcomes, raising educational standards, and creating more jobs. But there's always room for improvement. Hyde-Smith explained, "Getting this bill through committee is a significant step toward turning these plans into reality for our communities." As the chair of the Senate Pro-Life Caucus, Hyde-Smith has championed legislation aimed at supporting expectant families, and some of the projects included in this appropriations bill reflect her commitment to this cause. She's also deeply interested in expanding educational and vocational training opportunities, whether that's through agricultural aviation, nursing programs, or coding classes, to help Mississippians gain valuable skills. Key funding highlights for Mississippi in the FY 2026 Labor HHS bill include Labor, $5.3 million for the Advancements in Manufacturing Upskilling Program at Mississippi State University, $700,000 for digital workforce education through Mississippi Coding Academies, $500,000 for the Workforce Training Field School, managed by the Mississippi Department of Archives and History. Health and Human Services, $4.5 million allocated to the Cancer Research Laboratory at the University of Mississippi Medical Center. $2.5 million dedicated to improving maternal health outcomes via the Mississippi Public Health Institute. $1.7 million for a labor and delivery project at Memorial Health System in Gulfport. $396,000 to enhance hearing healthcare access at the University of Southern Mississippi. $250,000 for perinatal training programs for medical residents through the Mississippi. This office is tasked with coordinating rural health efforts across CDC programs and developing strategic plans to improve healthcare access in rural areas. During the committee markup, Hyde-Smith also proposed an amendment aimed at increasing transparency from the Centers for Medicare and Medicaid Services, CMS. The amendment would require CMS to provide detailed justifications and impact analyses before terminating Critical Access Hospital, CAH. Designations, an important safeguard for rural hospitals. Overall, the Senate has now approved 8 out of 12 annual spending bills for the upcoming fiscal year, which begins on October 1st. These legislative steps are critical in shaping the future of federal support for Mississippi's health, education, and workforce development. But the question remains, will these funds truly deliver the promised improvements? Or are there underlying challenges that could hinder their impact? What do you think? Are these investments enough to transform Mississippi's future? Or is there more that needs to be done? Share your thoughts in the comments.